So what we'll do is we'll move ahead along to our next speaker. So thank you very much again, Karina, for that presentation. So our next speaker is Dr. Zila Sanchez, who is an Associate Professor of Epidemiology at the Preventive Medicine Department of Universidade Federal de São Paulo. She has a degree in pharmacy and biochemistry and pursued her postgraduate studies in the field of drug addiction, moving between qualitative and quantitative studies on alcohol and drug use patterns. She evolved one of the largest epidemiological studies on alcohol consumption in nightclubs called Balada com Ciência, I hope I pronounced that correctly again, which identified personal and environmental factors that increased alcohol consumption among patrons in Brazil. Her two main current lines of research are alcohol epidemiology and public policies and the evaluation of the effect of government programs to prevent the use of alcohol and drugs among adolescents. And today she will be presenting on alcohol consumption in Brazil during the COVID-19 pandemic, epidemiology and opportunities for public policies. So I'd like to hand over now to Zila.
Hi, thank you, Andy, and thank you, ICARA, for the organization of the seminar. I'm pleased to be here. And the good news is that data from Brazil is very convergent with data from Chile and Argentina. And it's great because from different perspectives, from different samples and study designs, we found similar results. So it shows that maybe what's really occurring or what occurred past year during the pandemics is mainly the reduction of alcohol use. We don't know what's happening this year or what will happen the next year, but we have similar results, including, Paula, you just asked about the alcohol industry. Here in Brazil, they use the same strategies they have used in Chile and in Argentina. They are doing a lot of promotions and online sales has increased. So we have similar strategies in our country. So it's interesting. In early 2020, we have wrote on a review article to try to discuss what we expected that would occur with alcohol consumption all over the world. We use these articles that have discussed other public health emergencies in other years, in other moments of our lives. For example, earthquakes, terrorism, and so on. And what we found that for some countries during these public health emergencies, we have an increase in alcohol consumption because of stress, of fear, anxiety, and so on, because of the social isolation, as Paula said, to cope with these hard feelings. And in other countries, we have, for example, a reduction on alcohol consumption because of reduction of availability, affordability, increase of prices, and the reduction on public drinking, and so on. So the doubt was at that time, what would occur for example, in Latin America, in Brazil, in Chile, Argentina, how the country would react during this pandemic, considering our patterns of alcohol use. And it was interesting to see that countries in different regions of the world had some alcohol policy changes, and they did very different actions. For example, as you know, South Africa in the early of pandemics, they have total prohibition of sales. They have changed after, but in the beginning, in the first month, they were they have total prohibition. We have, for example, some countries with limits of amounts of alcohol that could be purchased online. For example, Australia was they had this strategy. I'm talking about the strategy in the beginning of the pandemic, everything has changed after this. But we are talking about March, April, May 2020. For example, Canada has allowed the retail of the government, the monopolies of the government, to sell through home delivery. And in the US, some states has considered alcohol sales as an essential service. So each country has reacted in a different way. And we decided to do, the PAHO decided to do a survey in Latin America to try to identify what has changed in the patterns of alcohol use in all the Latin American and Caribbean countries. I was involved in the survey. Maristela Monteiro was the coordinator of the survey. We collected data, online data, from May to June 2020. We received the answers for 32 countries and 2 territories in Latin America and Caribbean. It was a non-probabilistic sample, as you know, so we have limitations on this. Our total sample was around 12,000 respondents, and only in Brazil we have almost 4,000 respondents. You can think that it's it's almost a third of the sample, but it's important to say that Brazil represents a third of the population of this region, Latin American and Caribbean. So it was an expected proportion of the answers. I will present now data from Brazil. The key finding is that in Brazil we saw a higher consumption, higher consumption in the binge drinking pattern when compared to other countries, and we saw higher indices of higher prevalence of anxiety here when compared to other countries. So we have an alert on this. But in general, we have more in all countries, but also in Brazil, more women responding to the survey, mainly in the age group of 30 to 39 years. And as I have previously said, we had, in general, when comparing the prevalence of any drinking per sex in Brazil and also in other countries, we have, in general, a decrease comparing 2019 and 2020. A slight decrease, but we have a decrease. And one data that's very interesting is different from what we expected. In Brazil, we know, and also in this study, we have reinforced this, that in Brazil, people mainly drink beer. And in 2019, we had most of beer and a third drinking wine. During the pandemics, we had an increase in the wine consumption and a decrease in beer consumption. So it's something for us to discuss, because beer is mainly consumed in parties, in occasions where people are with groups, and the groups occasion were reduced during the pandemics. And when we compare Brazil to other countries, what we have found, especially for binge drinking, Brazil has a higher Brazil had the highest prevalence of binge drinking during the pandemics when compared to other countries in this study. So it's also alarming, but it's our data. But it's curious to see that we have, when comparing 2019 to 2020, we had a decrease, a 12 points in prevalence decrease. And also, when we look to the group of 30 to 39, this binge drink prevalence was the highest. So this group was the most exposed to this pattern of binge drink or have episodic drinking. It depends on how we say, but the same concept. And so we found that this group, this middle-aged group, is a group with the higher frequency of binge drinking during the pandemics. So from May to June, half of the sample from this age, 30 to 39, has engaged in at least one episode of binge drinking, five doses or more. And as Paulo has previously said, for Chile, in Brazil, we have the same here. We found that most of our sample has no change in patterns of binge drinking, but we have around 4 men, around 25% that have reduced this, and 21% that has increased this pattern. So we have different groups. And then we decided to see who is the group that increases. But before saying what are the factors associated with the increase of this frequency of binge drinking, I want to show you that, again, here in Brazil, when compared to the results of other countries, we have twice the increase in binge drink frequency. So when we look all the other countries of the sample, we have 8% that have increased. And looking for the total sample of Brazil, men and women, we have 17%. So we have more than twice. And when we want to understand who is the group that's most exposed to this increase of the frequency, the group that needs more attention and more intervention in our public health system, what we found that it's for the whole sample, but in Brazil we have exactly the same the associated factors. The difference for Brazil is in the estimate, in the odds ratio, but the significance is the same for Brazil and for all other Latin American countries. What suggests that we are dealing with a phenomenon that is similar in the different countries of the region. What we saw, that the increase in frequency of binge drinking during the early pandemics, the first months of pandemics, was associated with being male, so maybe increased more, with all levels of self-report anxiety symptoms, from mild to severe anxiety. So anxiety is very associated with this increase. The amount of self-report strategies of quarantine. So the higher the number of strategies, for example, not leaving home, not taking public transportation, and so on, the higher the items of quarantine the person has practiced, the higher the increase in habits of drinking frequency. And also higher incomes are associated with higher frequency of habits of drinking. And one protective factor we found was, I cannot say protective factor because we are dealing here with a cross-sectional survey, but we have an association with an opposite direction from the others I have just mentioned. So not living with child was a risk factor, and who lived with child was protected for this increase in habits of drinking. There is another article from our group that has shown, Paula has previously mentioned, but I will just mention what were the patterns of alcohol use that we had measured. We have measured changes in drinking before 5 p.m., online socializing drinking, and drinking with child present. And what we have found in Latin America, that the quarantine or the lockdown strategies was positively associated with a higher frequency of online socializing, as expected, and with drinking with child present. So we have an increase of drinking while children are in the same space. We also had these anxiety symptoms associated with all patterns of all these patterns, drinking before 5, the online socializing drinking. So anxiety is something that is really in a strong association with changing in alcohol patterns during pandemics. And also higher incomes were associated with all these changes, the increase of drinking before 5, online socializing. So the higher incomes are in higher risk. So we have to have this in mind too. And women tend to report less drinking before 5 and less binging during the pandemic. One thing I would like also to show that it's a Brazilian data from this study is that we have here again the twice severe anxiety in our sample when compared to the other countries in Latin America and Caribbean. It's a very important information for our public health system. We have to deal with this. Our problem is not only alcohol consumption, but alcohol consumption and anxiety, and people that are more anxious and have more severe anxiety, they are drinking more. And our conclusions are just presenting in a nutshell our results. So 70% of our Brazilian sample drank during the pandemic, around 4% practice binge drinking. But in the other countries, we have a less frequent prevalence of binge drinking, and changing in the behaviors, the risky behaviors of drinking. We have a possible substitution of beer for wine. We have more prevalent binge drinking among this group of the younger groups, not the elderly, but the younger groups, mainly 30 to 39. They're in major risk. And we have increase in frequency of binge drinking among higher incomes, and a lot of anxiety here. It's important to tell you our limitations. So we have a small sample size for several countries. That's why we compared Brazil with all other. So we have power for this analysis, but it's impossible to compare with the separate countries. It's a self-selected sample, so we depend on online access and so on, you know this. And we are dealing with only data from the 4 months of the pandemic, so maybe it can be different. So just finishing, it's very important with this data, not only for Brazil, but all in Latin America and Caribbean. We have to strengthen our restriction on alcohol availability, especially online. So we have to enforce bans of promotion and online selling. In Brazil, we are selling a lot online for underage drinking because we don't have this how to control now. So underage can buy online without any restrictions. It's not good, and we have to deal with this. And here we in Brazil we have a good public health system called SUS, and we have to facilitate access for screening and brief interventions, considering that we have higher frequencies in Brazil compared to other countries of binge drinking and increase in other patterns of risk, as I have presented you. And I have to acknowledge our group that have worked in this study, and their names are here. And that's what I would like to show you. Thank you.
Okay, thank you very much, Zila, for that very interesting presentation. I see that Chris has kindly posted up the links for the 2 papers that you've mentioned in the chat. So if anybody is interested in reading up more in depth, please do have a look. So I'd like to open the floor for questions. And Ian, I see you've posted in the chat, but I'll also let you go ahead.
Yeah, as a clinician who treats people with alcohol dependence, often when they first come to me and they're drinking heavy, they're very anxious and depressed. And once I've detoxified them, their anxiety and depression levels fall off markedly. So I suppose my question is, you're finding that, you know, binge drinking is higher in amongst people who are anxious, but these could be alcohol dependent individuals, and their drinking could be causing the anxiety, you know?
Not only dependent drinkers, not at all. So we have we have also people that are not dependent with high levels of anxiety, and we have a two-way association. So binge drinking may increase anxiety, and the anxiety caused by the pandemics may be increasing the binge drinking for this group of highly anxious people.
Yeah. Did you measure SAD-Q, or did you measure? Did you have a measure of alcohol dependency in your samples?
Yeah, we have some indices of frequency of alcohol consumption every day, and we don't have audit, but we have the frequency. So we have even people that were drinking doing binge once a week with high levels of anxiety. So they would not feel the items of dependence, at least the 5 we have in our survey, but they were also extremely anxious.
Thank you.